G'day guys, it's Alex the Sports Physio. This video series is on prehab after an anterior cruciate ligament or ACL injury. This first video is on range of motion progressions. Now before I get patients to start, they must have a reasonably quiet knee, meaning it's not overly hot to touch, it's not overly painful to move, and it's not overly swollen. This may take between 7 to 21 days depending on the injury. In this time, most of my patients have had at least an x-ray to clear their knee of any fractures and ideally an MRI to confirm the ACL injury, but more importantly, ascertain the health of the meniscus as it may or may not need more immediate care. Now when the ACL is torn, it creates a hemoarthrosis or blood in the joint, and it's this heavy swelling that makes our knee stiff and lose range of motion. The first early range of motion exercise I use to get better knee bending is towel or band bends. Hold both ends of the towel or band and place it around the middle of your foot. Slowly bend your knee as much as it's able to by itself and then use the towel to assist the rest of the way. There is no need to force any unwanted movement at this stage. The range of motion will come back with repetition and some discomfort is generally okay with this exercise. A key tip is to have your heel on a frictionless surface to allow for smoother repetitions. To facilitate knee extension, I like to use knee pushdowns. To begin, have your leg on a frictionless surface or on a roller and try to straighten your knee as much as you can comfortably. Have your hands just above your kneecap and push down on your thigh to assist the last part of your available range of motion. A nice little trick is to use a power band and think about pushing your band away from you with your heel like you would a leg press. This will engage the quads and assist you in achieving a straighter knee. The amount of pressure I am putting through my hands is very mild to moderate as we are only facilitating knee extension and by no means forcing the knee straight. The key is repetitions, not a few big thrusts to achieve better range of motion. If you found the knee pushdown technique to be a little too tricky, go for the incline variation where we lie on our backs with the middle of our calf up on the bench, have a towel or power band around the middle of your foot again, and initiate the motion by pushing your heel into the band whilst also trying to straighten your knee out at the same time. This position is also nice for removing swelling as our knee is above our heart. All of these exercises can be done multiple times in the same day. Those first three exercises are great to use, especially when we can't weight bear very well initially after the injury. However, once we can start to do this standard pushback exercise, which is a great one for getting knee extension back and is probably my favorite one as we're in a weight bearing position. So standing with the band around the back of your knee and pushing your knee back into the band to promote knee extension. Think about locking out as much as you can comfortably by engaging your quads and pausing at the end of the motion to hold that knee extension position. After doing these exercises for a few weeks, we should have our knee almost straight, about 5 degrees off as seen on the right there, and about 90 degrees of bending. Once we've done this, we can move on to the mid-stage range of motion exercises. The wall slide is my favorite exercise for promoting knee flexion this time. So guys, set yourself up as close to you can to an open doorway so that your good leg is through the doorway and your bottom is as close to the wall as possible. Have your heel high up on the wall and let gravity and your hands assist your leg down towards you. When you get to the sticking point, gently apply that little bit of pressure as we've done earlier, and this will help to assist that little bit extra knee bending. Once you've achieved as much as you can comfortably, push back up and start the repetition again. In this same position, we can also do knee pushdowns. So you can have your hands on your thigh and redo the knee pushdown from earlier on in the video. So this is a great exercise because not only can we do assisted knee flexion, we can also do assisted knee extension. Now guys, remember that knee extension is always easy to get back when our quads are involved. So let's pop that power band back up on our foot, pushing it out against the band to facilitate quad involvement. So push out like you're using a leg press, and you can use your hands to facilitate the knee push downs. So essentially we can do all our knee extension techniques in this one position. So once you've achieved close to 100 degrees of knee flexion, we're able to get you on a bike and get you practicing bike skills. So bike half circles are a great way of just getting your available range of motion going. Now you don't have to have 100 degrees of knee bend to do little half circles, granted, but if we want to get you doing full circles, you are going to need close to 100 degrees of knee bending. So set yourself up on the bike and start going in a backwards direction as seen here. What this will do will start to give your hip the ability to contribute and give you some more clearance for the knee to come through initially. Start practicing as many motions as you can before you start to go cycling forwards, as it's more knee dominant when you're doing a normal cycling technique. Once you've achieved this, just doing normal minimal resistance cycling is a great way just to maintain a healthy amount of knee flexion. Once this gets really easy, what you can do is then drop the seat height to promote a deeper range of knee flexion. So finally, guys, we have our late stage range of motion exercises. Now, these are not for everyone, but getting into an assisted squat hold is a great way of promoting that last, 5-10 degrees of your knee flexion range of motion. So getting into a deep squat hold will use your body weight as a little bit of an extra force to help promote that last bit of the range of motion. Counterbalance this with your hands on the pole, and then once comfortable, start to sit and explore that range of motion. My last exercise for getting that last little bit of knee flexion back is sit backs with a roller. So pop the roller on the back of your legs there. Having a sit back down and pausing for a moment and then coming back up will just help to promote that last little bit of knee flexion range. If this is quite easy, pop the roller in between your legs this time. Come into that little deep sit for a moment and then come back up again. Repeat this repetitiously as you have done for all the other exercises in this video. Just don't overdo it, as it is quite an aggressive technique.